Pandemic, many parents avoided taking their children to the doctor over these last couple of months, but pediatricians have concerns about what will happen if those appointments are not rescheduled. Sandra Ali has a look in tonight's Kids at Home report.
Many parents are really worried these days about taking their children anywhere, especially to a doctor's office. But that fear, experts say, is having a ripple effect.
We saw an extremely steep decline in our patient volumes very, very shortly after this whole pandemic came to be.
Dr. Catherine Schaefer says the number of office visits at her practice have been cut by more than half.
I believe the date was March 17th, declined by nearly 60%, nearly overnight. And what we're hearing from our patients' parents is they're afraid. They're afraid to come in. They're afraid to expose their kids to COVID. They don't know what to expect.
The majority of children aren't going to the doctor right now because of concerns over COVID-19. A recent study by the American Academy of Pediatrics estimates children are missing anywhere from 70 to 80% of their scheduled pediatric appointments.
The wellness visit is not just about vaccinations. In the younger age groups, under the age of 2, that is the primary way in which we vaccinate them, but it's a unique opportunity for us to assess the whole child and their family.
Besides vaccines, experts warn the bigger issue is missing out on developmental milestones in younger children and detecting mental health problems for older children and teens.
They're no longer going to daycare, they're no longer going to preschool, they're not going to school, and so the other eyes that have been on these kiddos with regard to their development are also not able to keep track of how things are going. And so it really has this sort of domino effect, and it's concerning.
The overall message to parents: be cautious, but think carefully before missing those appointments.
It's a scary world out there, but there are people who are advocates for their children and for their children's health, and those are the pediatricians. We don't want to put any child at risk unnecessarily, but we have the unique charge with making sure that the youngest population in our country is safe and healthy and safe from preventable diseases.
And right now the CDC is warning we could see a real outbreak of preventable diseases, especially because the orders for vaccines for children dropped significantly starting in March. Back to you.
Going to be worth watching. All right, Sandra. Well, time now for our first look at the forecast. Let's take a